So good morning, everybody, and I hope everyone had a good weekend. To the essential employees and non-essential that are back, to the new world that we're in, welcome. And to everyone doing the right thing, thank you. And one of the things Dr. Whalen and I have continued to talk about for the last 124 days, 17 weeks and 4 days, and we'll hit 18 weeks this Thursday. Same message. You know what? Wear a mask, cough in your arm, clean your hands constantly, social distance, and be careful. And I'll get a little bit into the numbers, the uptick that we've been seeing. But as of today, we have 2,007 positive cases of the coronavirus, 413 people under mandatory quarantine. We have 10 more positive cases from yesterday. So there are 43 active cases in Albany County that we're working on, and there are 6,068 people that have completed quarantine, and of those, 1,964 tested positive for the virus have recovered. That's an increase of 10 recoveries from yesterday, which is always good news. There's 2 people hospitalized. That's 1 down from yesterday, which is good news. No one in the ICU again, which is good news. And no reported deaths, which is great. So it's been over 3 weeks since our last person passed away in the county again. So all the families, my condolences and prayers. But things in that nature are going in the right direction. On Friday, I was kind of like, pounding our chest a little bit for Liza and I, that we're the second lowest in the state of New York for infections. And that means we've been doing our job and people have been listening and doing the right thing. But as of today, we have 10.4 new positive cases each day for the 5-day average. The last was 8.8, so that's slightly going up a little bit. Again, we continue to tell people to get tested. It's available more. And the other thing I want to share with everyone, more people are starting to get tested. We started to have that nosedive a little bit, but now more people are getting tested. UAlbany is always available for testing by appointment in Seth Q Arena. So the drive-through and set up a walk-up appointment for the Seth Q Arena is 1-888-364-3065. And as always, our mobile testing sites that we're still running around, and I continue to try to get people to help us in the communities to get our numbers up there, because again, we've done it. We're the only ones in the state of New York, the only county that set this up, and we did that in partnerships with a variety of people to make that happen. So that data is going to help us going into the future. So please, by all means, call our number, 518-465-4771. Rite Aid in Colony is still running, so you can go there, going to riteaid.com. So again, the importance of coming up off of 4th of July weekend and social distancing, and why we continue to say that is for a variety of reasons, but unfortunately we're seeing a bit of the uptick in the capital region. A report from the governor yesterday found we had the highest percentage of positive in the state at 2%. The next highest for any region in the state was New York City at 1.3. So you can see we spent our weekend looking at our numbers and going through all the data, because this is stuff that we watch for. The state is also looking at Rensselaer County. It's part for the reason for the increase. They had 23 new positive cases reported yesterday, linked to people traveling back from Georgia, which Dr. Whalen brought up on Tuesday, talking about people traveling. The other issue we're having is snowbirds, people that have moved to, have summer homes down in Florida or other parts that now are coming back and not self-quarantining or coming back infected and spreading it without knowing it, So these are the reasons why the governor's put out the restrictions to, I believe, 19 states now. So I don't want to alarm people, I don't want to scare you, but it's something that we continue to look at and to tell people to social distance, because it does work. Here in Albany County, we had the 15 new cases overnight over the weekend, reported yesterday. We had new hospitalization, which I just talked about. The majority of the 25 cases reported from over the weekend came from congregate settings, including nursing homes, through none of which, thank goodness, we're at our Shaker Place nursing home. There were 16 females and 9 males. There was 1 positive case in the age group from 10 to 19. There were 8 new positives in the age group 20 to 29 range, which I've talked about before. Of the 9 cases I reported on Saturday, 8 were connected to 3 nursing homes, none of which, like I said, were Shaker Place, which is good. This could indicate what's going to come, and we're watching these numbers closely. So one of the things we continue to do, and I got to say this, Dr. Whalen and her team do a phenomenal job with tracing and tracking. I believe the best in the state of New York. I can say that. Your epi people are phenomenal because that's what it's all about. And you can track where people are at, and she can talk more about that. But thank you, Liza, to you and your staff, what you do down there day in, day out. Yesterday, we're at 3.77 a positive rate. That rate obviously has gone up from 407 to the fourth this week in the state, so we're climbing the opposite way, which we talked about, so which is alarming all around. I just want to go to the dashboard and talk to you about that group that I as people say, I love to pick on. And it's not that I like to pick on them, but if again, that's 365, and if you see the age group, 20 to 29-year-old, and even the 10 to 19-year-old is steadily going up, and the next is 30 to 39. And the reason why I point this out, because they're the ones with no signs or symptoms. They're the ones that continue to go out, and they're infecting people. Because like if you see people playing in the park now, AAU sports, and they're all socially distancing, but these kids are hanging out in the neighborhood because parents are like, I'm over this, I'm done. We're going to move on, and it's not done with us. And as this group continues, it's going to continue to stay out in the community, stay out getting other people sick that unfortunately either have underlying health issues or make that rate. And I'll let Liza talk about the rest of this stuff. But total persons tested so far were 58,000, almost 59. Total tested positive, 2,219. So, which again, people tested today, 815 so far, which is all good stuff. We want people out there getting tested and doing the right stuff. But again, to the parents out there, I know we opened up stage 4 after the 6th, started a lot of the baseball, the other sports that are going on. Please, moms, dads, make sure your kids wear masks, especially when they're playing with other kids or in their groups of kids. I know it's hard. I really do, and I know your kids aren't going to show any signs or symptoms, but it's for your safety, it's for your parents' safety, or it's for the senior next door safety, it's for anyone with underlying health issues. So as this number continues to go up, we have to monitor it. So I'll say this, do you want us back 7 days a week? Do you want to see our faces every day? So the people who don't want to see me, please do the right thing, spread the message, and help me stay off the news every day. And there you go. There's my pledge to you. Do the right stuff, you won't have to see me. But Dr. Whalen.
Thanks, County Executive McCoy. So I'll just go start with the data. Again, we are seeing the highest number of cases in the 20 to 29-year-old group. And it's important to note that a lot of those cases, they're not very ill. They may have mild symptoms. They may have just been tested because they were being screened for their jobs. And the risk, though, is that outside of their jobs and at home, they can spread this to other individuals who are more susceptible and can, suffer more serious illness. And that is what we want to prevent. As usual, I usually go into the state tracker here to look at the trends that we see in Albany County. And if you see here, this is the total number tested. We're still testing a fair number of people every day. This line here is about 800. And we did see a slight uptick here of a % positive. We had 1,200 people tested that day and 18 were positive. So we're starting to see a slight uptick in cases, which is a big concern, because when we see our numbers go up, as I've said many times here, it only takes a small number of cases to start what can be termed exponential growth of COVID in the county, and this means a higher risk of contracting illness for those that are likely to have a more serious course of illness. The reason that our numbers have been low, the reason that we've been doing well, is entirely dependent on the behavior of the public. It's entirely dependent on your behavior. So again, as we have reinforced daily since we've been here, it's important to remain vigilant. And this does mean wearing a mask in public, wearing a mask correctly, so not exposing your nose or your chin, and practicing social distancing, and hand hygiene. There are 3 rules that I think everybody has down at this stage. Everybody knows what they're supposed to do, but sometimes, unfortunately, we see a gap in what people know and what people do. And unfortunately, the consequences of that can be us going back to more prohibitive policies and the way we interact in the public. So we don't want to go there. I don't want to go there. I know the county executive doesn't want to go there. We want to move forward. We want to be able to get people back to activities that they love, but we need to do it very safely because we do not have an effective vaccine. We do not have a significant proportion of the people in the county that have had this yet. So most of us are susceptible. On the order of 98% of us are still susceptible to COVID-19. That's a big number, and it likely includes almost all of you that are watching this broadcast. So for all of you, this message becomes important, whether it's the behavior that you are doing yourselves, or whether you're influencing your children, or those that you interact with at your workplace, or your other family members. The reason why you wear a mask is to protect others, and to a small measure to protect yourself as well. We know COVID is a virus that usually travels through droplets, so wearing a face covering can protect you and also protect others that are around you. Please consider those that you are trying to protect when you wear masks. If you are young and healthy and think, well, I'm not going to get symptoms, that's not a guarantee. But think of the people that are, around you that you care about that may not fare as well. Today, I just want to give a shout out. My father, Dr. Michael Whalen, is 80 years old today.
Wow.
He is a survivor of stage 4 pancreatic cancer. He is a wonderful physician and was always a great mentor and dad to me. Dad, happy birthday. We want to keep you safe. Please, all of you, think of your family members, keep them safe, and keep us all safe. Thanks.
Thank you. Happy birthday to your dad. I just want to say this to everyone who's listening to this or watching. Workers are out there just trying to do their job. They're trying to put food on their table. They're trying to pay their rents. They're trying to pay their mortgage. They're trying just to get by. So listen, these are the policies. You got to wear. You got to wear the mask, like the governor said. It's a state law. They're just trying to enforce it. Like I said before, if you don't want to go into that business, then don't go in. You can order anything online. You can order your groceries online. They'll deliver it to your house. You don't have to step in these establishments. So don't put the workers in a bad place and make them be the police or make them have to say something, or you take your anger out on them. I shouldn't say this. I was just here and someone was throwing coffee cups around the other day over the weekend because they got mad they had to put a mask on. It's to protect the workers. And I could sit here with a mask on, but if Dr. Whalen doesn't and Sean doesn't, it doesn't help, right? That's why everyone has to have a mask on in order to this to work. The only thing that's going to do is stop you from spreading it to someone else, but not them spreading it to you. So please be kind to the workers. They're just trying to do their job. So to Dr. Whalen, too, thank you to you and the EPI team. As always, you do a phenomenal job there, so thank you. So some of the other crises that we're facing, right, is the economy. And I've said this almost 18 weeks ago. Safety and health come first and foremost before I worry about dollars. But we are tracking that. We are paying attention. And right now, we're literally down almost $16 million from the second quarter, which is a huge hit. Very, very huge hit. The first quarter, ironically, because you got to remember we didn't really start to March 12th with the coronavirus. Really, I think our first press conference was March 12th. We were dealing with it a couple days before, but we had the first thing the March 12th. January, February, beginning of March, and obviously before we got shut down, everyone went out to the grocery store and continued. So the first quarter, we're up 4.49%. The second quarter, we're roughly down over 25%, which is a tune of almost $16 million compared to last year. Huge hit. That's just the second quarter. That's not including other hotel revenue, car revenue, everything else that we collect on. That's going to be a huge hit, and that's why I kept saying when we were predicting this, $30 to $40 million that we're going to feel here in the county. Same thing with towns, cities, and villages, because obviously when you budget, you do your budget, you budget for this money. Now that money's not going to be there. So July 20th is such an important day for the fifth stimulus package out of DC. That's why we need that bailout for counties. We've been on the front line. Our service has been out there. Our people been working. So we need that revenue to offset that. Thank goodness, I will tell you this, that when I took over, we had a little over $20 million in our reserves, and the last, I will say the last 6 years, I built up our reserve to over $68 million. I haven't the last 2.5 years put anything in our reserves because, when you give tax breaks and other things, you can't put more money into reserves, but we've done well. The first 6 years I was in office, putting stuff aside, and also, paying our bill down. We owed the state controller $38 million. We amortized payroll, and we were borrowing $15 million to make payroll. That was from that little recession of 08, 09. So I just want to give people an idea. What we faced in 08, 09 to dig ourselves out of that is nothing what we're going to be faced with the economy going forward. So I just want to keep everyone in tune with that as we go forward, because we do need that. We need Senator Schumer, Senator Gillibrand, Congressman Tonko, and everyone to do their job and focus on getting this relief, not just for the county, but as Governor Cuomo has eloquently said time and time again, the bailout the state of New York needs, because we were hit the hardest in the beginning, and the financial impact the state has taken. We're in this together. We're going to get through this together, and we're going to need the President, Congress, and Senate to put the party politics aside to get this done. The same thing with the Albany County Legislature. Got to put the party politics aside, and we need to lead, and we need to come up with solutions that we're going to have going forward with this difficult budget that we're going to be facing, whatever the state passes down to us in October. So tough decisions are going to have to be made on top of a crisis that, as everyone's aware of, is not going away. We kept hoping ourselves that it would stop and we get some relief. Again, I'm not trying to scare people out there. We will continue to uptick. We will continue to have a second wave and take steps back if people don't continue to do the right thing socially. So please wear your mask, cough into your arm, clean your hands, minimize your contact. The last thing we want to do is start shutting things down. And if you look at a major portion of our hit is because we have Colony Center and Crossgates here in Albany County, seeing that they've been closed the longest. That's financially draining us as them doors stay shut. And again, but for the safety and health of residents, I don't have a complaint. But we need to move forward. We can't go back, because if we continue to go back, 1918 is going to look like it was nothing compared to 2020. And this will drag into 2021. As the Whalen said, until we get a vaccine for this, this is going to be the new norm for a while. Overseas, a lot of countries have been wearing masks for a long time, and unfortunately that's where we're going to be headed. And I hate to say that to the people out there that don't think it's real, don't think it's happening. Look what's going on in Florida, the uptick in Florida. Look at Georgia, look around California. I mean, huge upticks. I don't even see how they opened up Disney in Orange County, Florida, because they had 120% increase in just one day. The rate, if the way this morphed, and if you have questions, you can ask Dr. Whalen, because I'm not going to pretend I understand all of it. The way this thing has changed, the COVID, it's affecting younger population in Florida and Texas and states like that. Then it's here. It's changing as it goes. So you have to create a vaccine for what you had now as it changes going forward. Again, not trying to scare people, but realize the new world we're in, and we continue to do good things working together. So switching gears again a little bit, I just want to say about our summer youth program. We're still dealing with some of the gun violence, and we're seeing in our communities, the county's providing funding for youth programs that can range from physical fitness, sports, arts, music, and community service. So please submit your to our division of purchasing by today. Close of today is the last day we can take any applications in, and that number is 518-447-7140. For the people that are just hearing about this for the first time, or they see this, we will try to extend it if you come to us with a great program and something different that the community needs. Again, I'm going to be doing a check presentation today with the United Way and with the Black Caucus on a music mobile idea that Wanda Willingham had working with the community. I can't thank Pete Gannon enough, but they're going to be donating a check for $15,000 into Borough Ecor. I said his name wrong again. I got to practice your name, buddy, but I apologize. But into Norma Chapman and Mert Simpson and Carolyn McLaughlin and Bill Clay and Sam Fine. Thank you for this work that you continue to do. The money will be used, will go to the Lyrics 101 Music Mobile program focused on underserved neighborhoods of Albany, providing youth with an artistic outlet. Participants will build valuable skills that can help them through their lives, including creative writing, music production, studio engineering, language development, and obviously they're going to have fun doing this, and it's going to be a van that will go around to different areas in downtown Albany to make this happen. So I do want to say thank you to all them. It will be a fully functioning recording studio and DJ setup, and we can talk more about the program when Pete Gannon and Wanda Willingham get here, but that's going to be something we're going to be doing. So again, as always, the program is going to cost nearly $108,000. The $15,000 is going to go a long way, and with the Boys and Girls Club to make this happen, but people can still donate to it, so please do. As always, businesses, we have the hand sanitizer at the TU Center and the EOC in Clarksville with Sheriff Apple. Again, call that number if you want to pick up anything, 518-487-2023. And then, as always, our mental health is available 7 days a week from 8 a.m. to 6. And that number is 518-487-2023. Excuse me. I gave you the one for the Time Genius Center. So 518-264-6634, and our 24-hour sexual assault hotline, 447-7716, and the New York State hotline, as always. Thank you, everybody.